What's up, guys? Today I wanted to talk to you about ProFit's blood testing and how it's different from the typical labs that you would get at a physician's appointment for a yearly physical and things like that. So typically when you go to a doctor, they were going to be looking for your cholesterol, your blood glucose, maybe sex hormones, maybe micronutrients. It kind of just depends on the provider. But a lot of those labs can go unnoticed when it comes to pre-existing conditions or the development of disease in the future. So what we like to do with functional medicine or with ProFit labs is we like to prevent disease progression and from these kind of things like insulin resistance and diabetes from developing before it's actually a problem. So the typical lab panel that I run on my clients checks everything from a full metabolic panel, a CBC, CMP. I also do a full thyroid panel, which includes TSH, T4, T3, free T4, thyroid antibodies, and reverse T3. The reason you want to do such a comprehensive thyroid panel, which I learned personally through my own thyroid struggles, is you actually get a more comprehensive picture as to what could be creating imbalances with the thyroid, whether it's gut related, food related, like meal timing or nutrient amounts like calories, or if it's something more genetic and maybe even something induced by stress that we can fix once we alleviate those root causes. I also have some pretty extensive inflammation testing on my labs. I do both homocysteine and C-reactive protein to kind of look for methylation issues on a genetic level, also micronutrient deficiencies like B12, folate, magnesium, and vitamin D. Pain, it'll help overall with mental health, gut issues. There's a lot of things that encompass inflammation, and that's why it's really important to deal with that if you do see it come up on your labs. So with ProFit Labs, I also have the ability to custom add markers, kind of depending on the client and the symptoms they're experiencing and things they want to check for. A couple things that I'll add occasionally are markers like for Epstein-Barr, any kind of markers for autoimmune diseases. Also things like DHT, testosterone, which in men and women, it can create things like cystic acne. In men, it can create issues with hair loss related to testosterone. Your body can actually convert testosterone into DHT, testosterone, which in fact attacks the hair follicle and can cause hair loss. And it's something that we can address nutritionally and with supplements too. And then after that, after we have those test results back, so the software analysis will take your test results and compare to what's considered an optimal reference range. And what optimal means is it's a little bit smaller of a typical reference range that you'd see at most physicians. So for testosterone in males, for example, the optimal or the reference range at typical labs is anywhere from 200 to like 600 or 800 is considered normal. Well, most people realize that big of a reference range, there's going to be a lot of variation on how people feel based on their genetics, their individual training style and stuff like that. So it's really important to actually look at your reference range according to what is optimal for your age, your gender, and also your training style, because that will vary a lot. So the software makes it super easy. I'm going to try and cover up my patient's name to see the optimal ranges so that you can see kind of where you are in relation to the green. The green is optimal, and as you can see, this patient is definitely... All right, so back to where we were. You can kind of see based on their optimal ranges of their thyroid that their thyroid isn't performing that well, and there's definitely some nutritional adjustments we can make, both with micronutrients, food timing, and food amounts that will help us get this thyroid range back into an optimal level and help the client and patient feel a lot better, feel more like themselves. And having issues with your thyroid can also contribute to a lot of mental health disorders such as depression and anxiety. And it's something that I work very closely with a lot of my clients. So I'm excited to see how this client goes. So when someone has below optimal thyroid ranges, for example, they are going to have a difficulty losing weight. They're going to have difficulty with energy. They may feel cold and tired, fatigued. This also comes along with brain fog sometimes. And typically the thyroid is very responsive to stress, to nutrients, and to sleep. Also, any gut-related issues can lead to poor absorption of your micronutrients, which in turn negatively affects your thyroid. So as you can see, there's a lot we can do with this blood test. And since I mentioned micronutrients and stress and how they can correlate to your thyroid, I wanted to show you the same test results with the micronutrients as well as her sex hormones and her cortisol, which is a stress marker. Now, cortisol is usually best monitored via a Dutch test, which is what I would typically use when I'm working with females to try and regulate their cycle, but I usually start with a blood test to kind of get a base analysis, and then we work from there picking what test they need next. So here are her levels for vitamin D, B12, and folate. And as you can see, they're all at the lower end of the reference range. These micronutrients are all super important for the development and the production of your thyroid hormones. So these being low is an indicator that she's gonna have issues with her thyroid. Another marker that I wanted to show you, or a couple markers, are her sex hormones, so that you can kind of get a picture of how these all correlate together. So you'll see most of her sex hormones are in the lower end of the reference range, which we are going to work on through nutrition. So we'll work together in balancing her hormones through nutrition adjustments, which include calories, macros, meal timing, and then also micronutrient, and healing her gut. A lot of the times people will neglect healing the gut first, which is vital because your gut is where all your nutrients are digested and absorbed. So it's kind of a waste of time and money if you're not healing your gut first in relation to a lot of hormonal issues, thyroid issues, and micronutrient deficiencies. Also, I was going to show you her cortisol really quick so you can kind of get an idea of how stress can affect your hormones and your thyroid. Cortisol is that marker right there at the top there. So you can see that her cortisol is pretty much tanked out, which can mean a couple different things. It can mean that she's dealing with a lot of stress right now, kind of like immediate stress. It can also mean that she's been dealing with stress for a long time and hasn't been able to manage it well. So we'll also work on stress management through lifestyle adjustments, adding in self-care. Adaptogenic herbs like ashwagandha and rhodiola are also really great options for managing stress. And then we'll just kind of make sure that she has some kind of plan in place for managing her stress so that we can properly address her gut, her thyroid, and her sex hormones. Whenever you order a lab through ProFit, all of our labs come with a free 45-minute phone call to go over your test results, and we talk about things that you can do nutritionally, lifestyle related, adjustments to training, as well as supplements and even hormone replacement therapy with our medical provider through ProFit if that is something that our clients need. Typically what we'll do is with somebody with hormone issues, thyroid issues, and micronutrients, I will sometimes suggest doing a GI map, which is a at-home stool analysis that looks at everything living in your gut, from good probiotic bacteria to bad bacteria, parasitic infections, as well as opportunistic bacteria, which can just overgrow in the absence of good positive probiotics. We'll also look at gliadin markers, which check for gluten sensitivity and inflammation in the gut. And then from there, I build a custom 12-week protocol that will heal and seal the gut. And once we've healed and sealed the gut, then we can then move forward with implementing more supplements and changes with nutrition. Another test that I run a lot, I mentioned earlier, is the Dutch test. And this is a urine metabolite test that I use specifically for sex hormones, because sex hormones in women specifically are more bioavailable with the metabolites in urine, which is a Dutch test. And the Dutch test will also look at your cortisol circadian rhythm. And from there, we can kind of decide exactly where the breakdown is in the production of your hormones and then begin to heal that process as well. I do offer free phone consults for anyone that has questions on labs or who is interested in finding out more about how labs can personally help them reach their nutrition and fitness goals. So if you have any questions, feel free to send me a DM, or you can schedule a free phone consult with me via the link in my bio, and I look forward to talking to you soon.